So, my article of choice is Population Attributable Risk for Cardiovascular Disease Associated with Hypertension in Black Adult. This study is conducted by Dr. Clark at University of Mississippi, along with his fellow doctors at various other university from all over the country. A little bit of background information. So high blood pressure is pretty hard to detect and it develops over time, and it can be due to a numbers of reasons such as consuming excessive amount of unhealthy processed food or not getting enough body movement or physical activities on a daily basis. So on the right hand side is an illustration of hypertension's complications. So with a normal blood vessels, the walls will not be as narrow so that blood flows and nutrients can pass through easily. Whereas with a blood vessels that has been damaged, it is very narrow and stiff. That's why blood particles cannot pass through and cause incidents such as stroke or heart attack or kidney damage. Hypertension is also a causal factor for cardiovascular disease. Um, Hypertension causes damages to the arteries walls and makes them less elastic. So the illustration on the right hand side compare differences between a normal heart versus a hypertensive heart. So the thickening of the walls of the ventricle with a hypertensive heart is caused by the heart trying to pump the blood extra because the artery is not as elastic anymore, so it can decrease blood flow and oxygen to the heart and cause problems such as chest pain, heart attack, or heart failure. And this is a prevalence of hypertension in 2017 among adult age 20 or older in the US. So we can see that the higher prevalence is among the East Coast state or the Midwest state compared with lower prevalence in the West Coast states. And here's some more information. So globally, only about 1 out of 7 people have their hypertension under control, and about 130 million adults in the U.S. or 45.1% of the U.S. populations are projected to have some form of CVD in the future, and so on. So this is a little bit about the journal article. So the title is Population Attributable Risk for Cardiovascular Disease Associated with Hypertension in Black Adult. It was published on the Journal of American Medical Association in 2019. And some key summary is the prevalence of hypertension and risk for hypertension-related CVDs is higher among Black adults than other races or ethnicity. The normal blood pressure and hypertension was defined using the 2017 American College of Cardiology and American Heart Association guideline. And the findings in this article emphasize the significant proportion of CVD's cases among Black adults that are associated with hypertension. So the objective of this article is to examine the population attributable risk for CVD associated with hypertension among Black adults. There were about 12,497 Black participants in the United States without CVD at the baseline. The population attributable risk for CVD associated with hypertension was 32.5, and this is a prospective cohort study. So here's information on the sample size. So this study used data from three different sources. We have the Jackson Hut study, the reason for geographic and racial differences in stroke, or commonly known as regards, and the 2011-2014 National Health and Nutrition Examination Surveys. The Jackson Hut study and the reason for geographic and racial differences in stroke were used to estimate the incident rate and hazard ratio for CVD associated with hypertension, and the National Health Nutrition Examination Survey was used to estimate the prevalence of hypertension among non-Hispanic Black adults in the United States. The Jackson Hut study participant was followed from September 2000 through March 2004, and the CVD event was adjudicated through the end of 2015. Participant in regards was followed from 2003 to 2007, and the CVD was adjudicated through September 2007. Jackson Hut study is a prospective community-based observational study. It estimated risk factor for CVD among Black adults. The participants come from four different groups. So we have the atherosclerotic risk in community study, randomly selected community dwelling residents, family members of enrolled participant, and volunteers. So we'll have 5,306 Black adults, 21 years or older. Um, the reason for geographic and racial differences in stroke or regards um, is used to calculate stroke rates among Black adults compared with white adults and other residents from the southeastern United States compared with other U.S. regions. There were 30,239 Black adults, 45 years or older from 48 contiguous U.S. state and the District of Columbia. Um, this particular source have an exclusion criteria, so any anomalies in their informed consent will be excluded, and if they are white adult, they will be excluded. And the exclusion criteria for Jackson Hurt study and regard data source is as follow. So we will exclude anyone with the CVD at baseline, anyone with missing blood pressure readings, covariate data, or no follow-up information. So the final numbers of participants is about 12,497 Black adults with 8,455 regards participants and 4,042 Jackson Hut study participants. The 2011 and 2014 National Health and Nutrition Examination Surveys was under the National Center for Health Statistics of the CDC. It monitoring the adult health of the U.S. population as a whole. There are about 1,896 non-Hispanic Black participants, 21 years old or older, without CVD history. Okay, so data collection for Jackson Hut study and regards. So information regarding their demographics such as sex, education levels, cigarette smoking status, physical activity, age, history of CVD events, any self-reported information will be recorded. With Jackson Hut study participants, the data collection will be through self-administered questionnaires, whereas regard participant, the data collection will be through computer-assisted telephone interview. So demographic information will be recorded. the height and the weight for BMI calculation. Blood and urine samples for total and high density lipoprotein cholesterol levels, um, diabetes, electrocardiography. Both Jackson Hut study and regarded participants will have their systolic blood pressure and diastolic blood pressure measured twice after the study for 5 minutes. And with the CVD incidence, it will be recorded within the 6 months interval. So any event has to do with heart failure, CHD, or cardio heart disease, strokes will be recorded. The information regarding the hospitalization or CVD event indicated in the medical record, which have been adjudicated by a professional physicians, or any information in the hospital discharge list from the Jackson Trine County Area Hospital, and any death events that causes of death from their medical record. Death certificate and autopsy report has indicated reason of death will it was because of CVD. With the NHANES, standardized questionnaires and medical evaluation at mobile examination clinic. Data information will be collected. Also, self-reported antihypertensive medication information. Blood pressure will be measured 3 times by a physician, and they will be using the mean of 3 times blood pressure measurement for analysis. Okay, moving on to statistical analysis. So the participant from Jackson Hut study and regard will be pulled together for all analysis. Um, the main finding will be the population attributable risk, which is defined as the proportion of disease in the study population that is attributable to the exposure, and the formula that was used to calculate the PARs for CVD, CHD, heart failure, or stroke will be as follow. With the PE is the prevalence of the exposure for the elevated or confirmed hypertension groups, and HR or hazard ratio will be the multi variable adjusted association between elevated and normal blood pressure in both groups. And the result will be as follows. Among the 12,497 participants, about 1,935 of them had normal blood pressure, 992 had elevated blood pressure, and 9,633 of them had hypertension, which is relatively high. And among the individuals with elevated blood pressure and hypertension, they are typically older adults with cholesterol lowering medications. They might or might not have diabetes and less likely to have graduated from high school, and their BMI score are relatively high. These people will be following for 14.3 years, and the prevalence for hypertension among non-Hispanic Black individuals was pretty high, about 53.2%. And the result for the analysis is as follow. So, regarding population attributable risk associated with hypertension, so for cardiovascular disease, the PAR will be 32.5%. This means that the overall risk for cardiovascular disease among hypertension, the population with hypertension, there will be 32.5% that was attributable for hypertension. Similarly, with the incidence for coronary heart disease, it will be 42.7%. Heart failure is 21.6%. Stroke is 38.9%. And the population attributable risk is higher among people younger than 60 years of age, which is a little bit surprising. And then we will move on to discussion with the result. So hypertension as has been known to have deep association with CVD events, especially among Black adults. About 50% Black adults have hypertension, and higher prevalence of hypertension associated with larger portion of CVD compared with other factors such as diabetes or others. Age-specific risk is statistically significant among adults younger than 60 years old because they are undertreated and lack of hypertension management among the young adult because they were thought to be less likely to have CVD events. And the conclusion for this study, so the findings align well with the previous studies in regard to association between hypertension and cardiovascular disease events. The PAR, or population attributable risk, takes into consideration both the prevalence of the risk factors and its association with an outcome. It also highlighting that the prevalence of hypertension have substantial association with CVD among Black adults in the United States. Incidence of CVD among Black adult associated with hypertension is pretty high, and the incident rate for CVD, stroke, and CHD is 3 to 4 times higher among individuals with hypertension. Um, the findings suggest that there should be a innovative approach to better manage hypertension and CVD events in the United States. So it can be pharmacological approach or none intervention approach, such as better regular physical activity, weight control, or adopting a heart healthy diet. It also considered reducing at a population levels, such as managing sodium intake because the U.S. sodium intake is excessively high than national dietary guideline. This study has illustrated very substantial points in statistical analysis to prove that hypertension, the relationship between hypertension and CVD events. However, there are some limitations associated with the study as well. So the strength is it has pretty good representation. It also used standardized protocols for data collection. It has pretty long following up time, and CVD event was adjudicated by trained professionals. However, there are some limitation. Um, in the study, it was suggested that higher prevalence leads to less precise PAR calculation. So that's one thing to be watch out for. Also, the data collection for blood pressure is rely on one single visit. So this study also has some limitations. So first and foremost, higher prevalence leads to less precise PAR calculation. Um, Also, the blood pressure measurement rely greatly on one single visit, which is relatively not ideal because blood pressure measurement can differ from day to day, depending on the person. Also, only this study only represent some particular regions in the US population. Therefore, it is not a conclusion for the entire US populations. Um, Also for data collection with the NHANES from 2011 2014. It did not update all the CVD events, so therefore it might not be as precise as it would be expected. Okay, finally, some final thoughts and opinions on this study, because this study has been done pretty recently on in 2009 in 2019 2018 2019. So the data and the collections of data was pretty much updated, and the information and the guidelines pretty much updated. So with the findings, um when I agree with what they found, and also I really like the design and the methods and the objective of the study. Um, However, there might be some possible type of bias, such as selection bias. So, as mentioned earlier, the study only represent Black adult in some particular part of the country. So, therefore, it might not be representative enough to conclude for the whole Black communities in the United States as a whole. Um, so, for example, if the Black adult in that particular reason in Mississippi has high hypertensions, numbers of hypertensions people in high and cardio vascular disease, it might not be the same for some other regions in the West Coast, in California, or in different states. So, therefore, in order to have a good comparison, maybe the possible solution can be a conducting a population-based cross-sectional cohort study with other races and ethnicities to compare the differences and compare other risk factors such as diabetes or any other, to have a fresh and better perspective, and therefore expert can have better approach or plannings or any interventions to help people manage their blood pressure better, or to help physicians and other care team members to educate their patients on the importance of managing the blood pressure, so that they won't have to experience fatal or chronic diseases such as heart disease or any other disease. And here are some references for this presentation. Okay, and thank you for listening to my presentations.